Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Today we will discuss the most important topic named teething, was known as dentition difficilis. Whether you are undergrads or in masters doesn't matter. This is important for both as clinically and also in theory exam as a question in short note or long note. First, what is teething? So, teething is the process by which an infant's teeth sequentially appear by breaking through the gums. So, basically, sequential eruption of primary teeth is known as teething. There is a relationship between eruption of deciduous teeth and the general health of infants. It shows signs and symptoms suggesting eruption period of deciduous teeth, and they might be local and symptomatic. So, local teething symptoms are gingival swelling, irritation, redness of gum rubbing, thumb sucking. Systemic teething symptoms are loss of appetite, crying, increased salivation, drooling, diarrhea, boils, general irritability, fever, runny nose, conjunctivitis, daytime restlessness, increased biting, wakefulness, ear rubbing, facial rashes, respiratory tract infection, urinary tract infection, and middle ear infection. Now, teething period is generally 8-day window period, which include 4 days before tooth eruption and 3 days following. Some studies found only a week. Now let's understand some basic symptoms in detail. Also, you have to write this explanation in answer. So first, irritability. As tooth rises closer to the surface, gum may become increasingly sore and painful. The pain and discomfort usually worsen when the first teeth and molars come out. This is due to the fact that molars are bigger in the size. Drooling. From 3 to 4 months of age, drooling is increased than normal. Teething stimulates drooling. Coughing. The extra saliva can cause occasionally cough or gag. This is usually nothing to worry about as long as baby does not seem to be in any discomfort, show signs of cold or flu, and run high fever. Chin rash. If infant drools a lot, the constant contact with saliva can cause the skin around the chin and the mouth to become irritated. To help prevent this, gently wipe your baby's mouth and chin periodically throughout the day. Biting and gnawing. A teething baby will gnaw on anything he or she can get their mouth around. The counter pressure from biting or gnawing on an object help to relieve the pressure from under the gums. Cheek rubbing and ear pulling. Pain in the gums may travel to the ears and cheeks, particularly when the back molars begin coming out. It is for this reason that you may see your baby rubbing his or her cheek or pulling at ears. However, keep in mind that pulling at an ear can also be a sign of an ear infection. Diarrhea. Most parents usually notice slightly looser bowel movements when a baby is teething. It is believed that the most likely cause of this extra saliva swallowed, which then loosens the stool. Also, because of biting anything, they can get infections of gut like diarrhea. Low grade fever. A low grade fever can be defined as a temperature above 36.5 degrees and fluctuating constantly but not exceeding 38.5 degrees. It is important to notify your doctor if a fever lasts more than 2 days. Not sleeping well. With teething pain occurring during the day and night, you may find your child wakes more often at night when the pain becomes too much. Most parents agree that the child wakes more often at night during the first set of teeth and when the molars come out. Cold like symptoms. Runny nose, coughing, and general cold symptoms are believed to be caused by the baby regularly having his or her hand in their mouth. If you are doing masters, here are some studies related to teething symptoms which will help in your exam answer writing and viva, where citing studies are one of the important things. So the largest study by skin showed significant association with biting, drooling, gum rubbing, irritability, sucking, and temperature 37.5 degrees Celsius. The result presented by Jaber et al. Considered only temperature and only included in children before the emergence of their first tooth. The survey was conducted among Finnish mothers to know their belief about teething. They found that 90% of the mother believe teething cause gum rubbing and finger sucking, 77% that it causes drooling, and 50% that it leads to fever, sleep disturbances, and daytime restlessness. Correll, citing 18 studies from Americas, Asia, Africa, and Australia, commented on the near universal belief across folk cultures worldwide that teething is related to diarrhea. Delayed teething may be associated with several disease related conditions such as hypopituitarism, hypothyroidism, rickets, and syndrome like Down syndrome and cleidocranial dysplasia. 1% of healthy children may not have had their first tooth by 12 months of age. So, the conclusion of all prospective studies are that no specific symptoms or clusters of symptoms can reliably predict the emergence of a tooth. Furthermore, symptoms that might be attributed to teething are not serious, and the presence of fever or other clinically important symptoms are very unlikely to be caused by teething. This is borne out by Swan, who received 50 children admitted to hospital with a presenting complaint of teething. In 48 children, a medical condition was diagnosed, including one case of bacterial meningitis. This is just for your information. Teething is viewed by parent as a significant event in growth and development of child, and they usually get consent when their infants don't have a tooth by 9 to 10 months. There are so many other studies, and here is the one article has included main studies from 1999 to 2019. In second part, we will learn about the management of teething. Till now, if you want these as PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll send you the PDF. New videos on Sundays for now. Also, we will put lots of important things on shorts soon. So subscribe and press the bell icon for that. Like, share, and subscribe. Thank you.